being here. Good news, no new deaths over the last 2 weeks. So this is very positive. Very happy with what's happening in our hospitals. People who get sick are getting better and getting home. So that's very good news. We have received 1,550 diagnostic tests back since yesterday. Our 7-day rolling average for diagnostic tests, again, the diagnostic test being the nasal swab, is 0.77%. In addition to these tests, Syracuse University has now performed over 23,000 pooled saliva tests since the beginning of August. This has not been in any of our counts. Between Syracuse University and our own school district back-to-school testing this week, there have been over 5,025 pooled tests completed in the last 7 days. From these pooled saliva tests in the last 7 days, we have only had one positive case at Syracuse University. Combining our nasal diagnostic and pooled saliva tests, our 7-day rolling average is 0.56%. So certainly good news, especially when you look at the testing world. Again, we've been talking about this with insurance companies not covering asymptomatic tests. We've seen less asymptomatic testing going on in the community. We view that as a problem. We're working on ways to try to address that. But even though it is a problem, the fact that our rates have not gone up, which means who are we testing for the diagnostic test to get this way? We're testing folks who are sick, who have symptoms of COVID. We're testing employees and sometimes residents of senior facilities where we know COVID has been in those buildings. We're testing folks who have elective surgeries or direct contact with folks who have COVID. And now we're testing students and employees going back to school. So one would think when you're limiting who's being tested, your rates, your positive rates and infection rates would go up because it's getting back to more of a stronger sample of symptomatic testing, but it really hasn't. So that's very good news. But we do view the fact that asymptomatic testing, insurance not covering that, is a problem, and we're working on solutions to get creative to continue to be able to do that. But good news. Certainly we're very, very excited about Upstate and Dr. Middleton's approval from New York State to allow a diagnostic determination from the saliva test they developed. This saves time and money. This is really important when we're looking at isolating cases. Before, with this test, we would get a positive. We would then have to go find the student, get another diagnostic test, wait to get the negative. That time is gone. Now we have the positive. The positive is the positive. We can quickly isolate, and also that cost of that test, diagnostic test, is now no longer necessary. So very good news. Again, I want to thank our partners at SUNY Upstate. They've just been tremendous. Dr. Middleton, we're very lucky to have them all in our community. 14 individuals in the hospital, none in the ICU. That's very good news. I think we've had 3 or 4 days straight of none of our neighbors being in the ICU. Again, this was something we haven't seen since mid-March when the pandemic came to us. Out of who's in the hospital, 11 Caucasian, 3 individuals have not shared their demographic data with us yet. Overall, we've had 3,793 positive cases. That's up 9 since yesterday, so 9 new cases. Out of the 9 cases, 1 household contact, 8 community spread, 3 of a known source, 5 of an unknown source. Active cases, 175, same as yesterday. Looking at active cases on Syracuse University's campus, 9 active cases. That's really remarkable when you see what's going around with campuses across the country, even in New York. It just shows you the program that was put forward was really one of a kind. The fact that we have 15,000 plus students in the community, and we have 9 active cases on campus, and all of these students being regularly tested. It's really, Syracuse University really needs to be proud of themselves. The students who are now learning to live with the virus at college need to be proud of themselves to date. and certainly our emergency management team and who helped work with them as well in our office. This has been a great effort. Looking at recoveries, we had 9 new recoveries since yesterday. 3,419 people have recovered. Looking at who our cases have been, 2,182 female, 1,611 male, 338 under 19, 764 in their 20s, 505 in their 30s, 452 in their 40s, 566 in their 50s, 424 in their 50s, 424 in their 60s, 308 in their 70s, 275 in their 80s, and 161 in their 90s. Back to school testing, again, we've tested over 1,325 school district staff, and all of them have been negative. This is the closest thing we've done to basic blended testing. The fact that we have no positives out of that is very good when we look at what that means for the community. Today we're testing at 2 locations, West Hill High School, West Hill and Solvay districts are there, and then Bishop Ludden for all the Syracuse Diocese schools. Tomorrow we will be at North Syracuse to test the Cicero North Syracuse School District. That's at North Syracuse Junior High School. Again, looking at future sites, next week, Tuesday, September 8th, West Genesee High School. Wednesday, September 9th, Fayetteville Manlius High School. Thursday, September 10th, Liverpool Elementary School. Then the city school district will also be testing Thursday, September 10th at NBT Bank Stadium. And then Friday, September 11th, we will have open testing for all district employees from any district of individuals that did not make their original dates at NBT Bank Stadium. Really want to thank again Upstate Medical, our emergency management teams, and Essentia Health for helping us do all of this, again at no cost to the faculty. So that's really important. Looking at a couple other topics, relevant topics, we received a sales tax payment today, down $3.2 million compared to the same payment last year, or down 12.6%. It represented the August 1st to 21st period of time for electronic payers. Oftentimes, there are payments that come later on in the year that are actual bills go out to these payers and they may owe more money. We call them cleanup payments, but this is a period of time. Our last substantial payment we received, we were down 12.8%, so this is slightly better, but certainly solidifies our fiscal reality and solidifies the decisions that we have to make moving forward. Our year-over-year budget is off 10.25%. Our budget number, we're off almost 13% at this point. Looking also, Labor Day is coming up. The last time we saw any real upticks in positive rates, infection rates, was 4th of July. What we saw was gatherings, people enjoying themselves, people who were sick and symptomatic, not staying home, and we can't have that. So I want to encourage everybody to be smart over the holiday weekend. Enjoy the weekend. I know it's usually the end of summer. This is summer in a pandemic, so we need to be smart. If you are sick or have symptoms, please stay home. Avoid the barbecue. Cases over the last 3-4 weeks, many of them have been driven by those types of decisions where folks weren't feeling well. They went to wherever they're going to go anyways, and next thing you know, many of your friends and loved ones are sick or in a quarantine. So please avoid that. Be smart. Enjoy yourselves. Physically distance and wear a mask if you're going to be within 6 feet of each other. Again, they may be your friends and your loved ones, but you don't know who they've been in contact with. Gym inspections. We've done 104 gym inspections to date. Tomorrow is the deadline put forward by the state of New York. If you still have not gone to New York Forward and you're a gym owner, go to New York Forward. do your business affirmation, so then we know we need to schedule an inspection. I want to thank our team of gym inspectors who have been out there working hard. We never had gym inspectors before, so this was all new. Our health department, certainly our gym inspection team led by Arthur Karpinski did a great job. So I want to thank them for the work they did, and certainly want to acknowledge the voice of our office, who's taken more phone calls in the pandemic, Pam Marcello. It is your birthday today. Happy birthday, Pam. So saying that, happy to answer any questions.
Brian, do you have any update on your workforce reductions, layoffs, or furloughs?
Yeah. We have met with the CSEA, our largest bargaining unit, twice now. I think they're meeting right now again. We are doing everything we can to keep our workforce as intact as we possibly can. They have referenced the willingness to talk about furloughs. Again, just so everybody understands, the only time we've talked about furloughs until our resolution was at the legislature was months ago, and it was a plan that just wasn't workable. So the resolution comes to the legislature. CSEA is interested in furloughs. That was news to us. We're happy to talk. We've talked 2 days since then, and certainly the reality is there is a gap. The gap was massive, but we have used cost-saving measures and are using our rainy day fund to a certain degree to get us to a point where we might be able to make up that gap, but there's no way to avoid workforce disruptions at this point. So if it's a blend between some furloughs and layoffs, however we can get to the number we need, and again, that number we need may get bigger if the sales tax data doesn't get better. We were kind of anticipating the number we needed to see improvement in sales tax data, not 0.2% improvement, but better improvement. We have a cleanup payment later this month, and then we have a very important October payment, and that October payment really needs to get stronger, or else the number we need to fill our hole is probably larger. But whatever way we can do this best for our workforce, again, our workforce, I'm not sitting here saying our workforce has performed poorly. We need layoffs. Absolutely not. It's the absolute opposite. Our workforce has performed very, very well in the most challenging times in the history of county government, but we have no other options. So we're talking. Hopefully we can come to some agreements that work for the workforce and work for us. But I can't imagine anything that doesn't have a blended result to get to a really $6 million number.
And today's sales tax payment pretty much leaves you with the $6 million number. That doesn't change.
Yeah, we were hopeful that we would see some improvement that would have helped that number a little bit. Again, there's another smaller payment. It's a cleanup payment. The cleanup payments have been a little bit better than expected. And when I say cleanup, what it basically is remember, the businesses are making estimated payments, and then they get their actual bill from New York State. And so when they get their actual bill, many of these businesses have owed a little bit more money, which then has been in line more with last year's number. So hopefully we'll get a little bit of good news there, but that's a small payment. But really, we thought today, it could have been worse today, but we thought maybe it was going to be a little bit better.
What about management confidential employees? Are you looking at across the board furloughs or something?
Yeah, we'll probably offer, again, management confidential furloughs. I don't need to negotiate those. So we'll probably offer some sort of furlough opportunity to folks. But again, we're not, our workforce is our workforce related to when we're looking at layoffs. This is just a position we don't want to be in, but certainly we haven't been saying. I saw some of the rhetoric, a little disappointed in some of the rhetoric, because our workforce knows we've gone lengths to avoid this position we're in. Nobody's been louder. to advocate, and nobody's waited as long as I have when you were looking at the type of crisis we're facing. So the reality is this is not a management-heavy government. That's ridiculous. And whatever we do will be a balanced approach with our management confidential and our union employees. We value all of them.
When you say offer furloughs, would that be voluntary?
Yeah, we'd probably look at voluntary for MCs. Yeah, probably voluntary, and then from there we'll go from there. One of our tools is for MCs. We may put out our retirement incentive again, one last chance. See what happens. Again, that would have to be negotiated with the bargaining unit.
I know you've waited as long as you can for this. Does that make it easier or harder to kind of fill that hole that you're trying to make up?
It makes it harder. The easy thing to do would have made this decision in April, and to go and just have layoffs in April. We were in the middle of a pandemic in a response to the 100-year virus, and so we couldn't do that and be comfortable with our ability to deliver the necessary services. Also, we did not. Last thing we wanted to do was put people out of work. So the union knows that. Everybody, my workforce knows that. Again, these aren't strangers to me. These are people who are who I believe in, and hopefully they know I got their back. They all know that. But yeah, the easier thing would have been to go make this decision months ago, and then we're not watching payments come in and seeing what happens. I was told in May that there was a good likelihood we would get some federal help, and then I was told in June, then in July, and then the messaging in August has gotten a little murky, and certainly we've seen what's happened. So we had reason to believe that there was help coming, and also reason to believe that maybe the state of New York when it cut us 20%, but that's happening too. So between the state cuts and the lack of federal help, we're left solving this problem by ourselves, and at the same time being told that the services we have to are mandated to do can't be disrupted. So really impossible position that we've been put in, but we'll be up for the task.
How frustrating is it that every week you're up here kind of waiting for help from higher up governments and your hands are tied?
It's really frustrating, and it doesn't help that we're in this super tense electoral cycle. I mean, the rhetoric going back and forth between federal and state leaders is really something that you wonder why we don't have a deal, but some of that rhetoric doesn't help make a deal. So I think the reality is this is where all the work is done at the local level, and so we're left doing the work, implementing policy, and unfortunately looking at unprecedented mid-year cuts. And again, this is not a 2020 problem. I've heard some people say, some of our newer legislators say, well, just go use more reserves. Okay, well, what do we do in 2021 then? What do we do in 2022? What happens when we need to go bond for a wastewater treatment facility because it breaks down, and because we used all our reserves, which the legislature told us you got to have so much in the bank, we break that rule. We want to go bond, and we got junk bond rates, and then it cost that. So, some of these folks, one of the good things we haven't done here locally to date is play politics and pandemics. We don't do that here. A couple people are borderline right now, but these are things that our administration has proven to our workforce. We'll do everything we can for them. At the same time, the charter says we have to have a balanced budget in 2020, and at the same time, we're preparing a 2021 budget that will try to get us back on firm footing so that we can continue to fight the pandemic and also look at economic recovery as well. You said the messaging is murky. What was the last time you talked to Congressman Katko about his role in all of this, and what does he say? I talked to the congressman last week, it's the challenge is you have 35 or so states that their governors and their local leaders are saying we don't need help, and 35 times 2 is 70 U.S. senators. So that's a challenge, and so You know, I think then you have the bill and negotiations. Look at, I think the White House put more money on the table this week. That's promising. Some of that looks like it would go to state and locals. It's not what's needed. But at some point, you got to get a deal done and get a little bit of something. Certainly we don't expect that the federal government's going to come in and solve our problem at this point. If we can get a little bit of help, we'll take it.
Can you wait for that October sales tax payment before you pull the trigger on job reductions? No.
No. We have. We'll have to do something in September.
Any numbers in mind yet?
No. We want to continue to talk with the union and see what what we can come up with. But we can't wait. We're certainly not going to go all in September, but we need to do something because as time goes on, as to Tricia's point, we lose the ability to close the gap. So unfortunately, something's going to have to get done in the next week or two here.
Do you have any idea what departments those jobs will come from?
Not ready to talk about it yet, but we certainly have identified some areas that we think would be phase one.
School starts next week, and a lot of schools are on the hybrid plan, which, as you pointed out, just raises incredible complexities for childcare. Do you have any updated sense of whether that is still going to be a huge problem, or
I think it. Yeah, I think it's going to be a problem. It's going to cost people more money to solve the problem, my hope is that the districts that have came out with their initial plans, we've seen some of them change their plans going backwards. My hope is some of them will be nimble and potentially change their plans doing more if the data merits it, right? And if we have success as the school year starts, which I think we will. I think we will, and we're gonna get through the adults, and we're gonna start doing some of the high school kids. But I've talked to some superintendents who are kind of taking that mindset. Maybe we can do a little bit more if things go well, and that will help alleviate that. Again, parents are talking to the superintendents now frequently, and I'm not, Tim, I don't quite know the true gap in potential child care slots or anything like that. It's just so hard to get our hands on it. And I think with the city school district doing what they did, I don't know if that helps that or doesn't help that. But overall, I know we hear from parents all the time that now have to find not just child care, but child care for 1 or 2 days a week. And again, if you're a child care provider, you'd rather take the kid that you're going to have 5 days a week than 2 days a week. So it's a challenge. It's a challenge, unprecedented challenge.
When schools open, and if there is a child or a teacher who tests positive in a given classroom, do you know from a quarantine point of view, would the health department consider everyone in that classroom as someone who should quarantine?
I don't think it's an automatic everyone does, but I think that could be the outcome, right? And so depends on exactly did the teacher or adult, were they positive? They take a test on a Saturday, they find out they're positive. Again, we have quick turn times in testing now. And then you go back 48 hours, where were they? How are they interacting in that class? Who are they interacting with their peers? The contact tracers determine direct contacts. Some direct contacts go into a 14-day quarantine. Some people that maybe didn't have direct contact, maybe they get recommended for testing. These are the things, but it will be a case-by-case basis. But what you could have is the outcome being you have a classroom in a quarantine for a period of time. Sure, that could happen.
With school starting, what is just your overall feeling on getting kids back in the classroom, teachers back in the classroom, and all of that kind of starting back up again? I
think it's good. I think overall, really excited about what we're seeing from the testing we're doing. 1,300 tests, no positives. That is a 0% infection rate, so we like that. I think we got to take that next step, and we're going to learn about it. And I think the nice thing in our community is we've all been communicating together, not on so much, we're not all in lockstep so much on the academic plans, but when you look at what the testing strategy is going to be, we're going to be very involved with that for the screening in the buildings. When you look at the fact we're making sure that the employees are going to have PPE, Dr. Gupta was on a call today with over 100 nurses from the district. So on the public health side of things, everything is working very well and preparing it. The curriculum, distance learning, hybrid, in-person, that's out of our wheelhouse. So people will have to judge how that works by themselves. But certainly with what it means with COVID-19 and we doing everything we can to keep that out of those buildings, we're doing it.
The Emergency Management Office has worked with like every healthcare provider in the county to get various kinds of equipment. Are they getting requests from schools for things like, I don't know, air purifiers or any other items that could help with ventilation or filtration?
Yeah, there's districts looking at it, and I know that we have a great local company in Pulaski that did a huge deal with New York City, and we have local districts working with them as well. And I think each district, I think that's one of the concerns from some of the teachers, right, is that some of these buildings older HVAC systems, how do we know that this is getting done, getting cleaned out? Again, those are things that the districts hopefully put time in thinking of that objection. I know I would have, so those are things that the districts need to prove to their workforce that this is safe for you to come back. This shouldn't be a concern, or should be your last concern. But I think that's those are real things. Those are great items to really invest in the best technology if the federal government can get their act together. Everybody's saying, let's get money for schools to get kids back. Well, you're going to miss the mark, guys and girls, down in D.C. It's getting pretty close now.
You get a lot of calls and emails to your office. What is like the general feeling from the community? What are they most concerned about right now?
Yeah, I think the anxiety with going back, the college kids coming into town was real. A lot of concerns there. I think we've had a great start. That doesn't mean you have a great finish. We always see it's always good to start the game. You get a lead, but you can always give it away, right, Trish? So that was people anxious there. We still have some businesses that aren't operating, and or you're starting to feel anxiety from the private sector about industries that will have a challenge in the colder months operating and what to do. And so this is anxiety that we're starting to see and feel, and we're pushing. And we're pushing from a position of strength because our data shows that we need to get these businesses opened that are on the sidelines still. Hospitality, we got to find a path to success here. There's more and more resources coming out for testing every week, and so let's figure out a way to yes. And I think there's positive news on the science front with various companies doing vaccine testing, third stage trials, and certainly if we saw a vaccine in 2020, I think that's a good thing, and that means that early 2021, hopefully that vaccine could be into our community's most vulnerable at first, and then be widely available to the public. Other questions? All right. Thanks, everybody. We will see everybody on Tuesday, not Monday.